Mrs. Meenakshi Krishna Byre Gowda is a most passionate advocate of women's health and well-being, an eco-warrior who has set the precedent by going all organic and minimizing the plastic usage to a bare minimum. Meenakshi ma'am has always been approachable, kind-hearted and super patient to the grievance. Thank you very much ma'am for complying to our request and agreeing to be a part of this session.
Hi, with me here today is Dr. Sireesha. She's basically gotten her education from the United Kingdom. She's returned back to India. She's a laparoscopic surgeon now in Motherhood. Okay. She has 20 years of experience. Her areas of interest include mainly fertility, reproductive medicine, doctor, miscarriage treatment, and high-risk pregnancy care. And she has to her credit that she has delivered 10,000 plus healthy and happy babies. It's really a pleasure to meet you, Dr. Sireesha. And today I think we are here to talk a little bit about the breast cancer awareness. I'm just going to be asking you a few questions because many of us are very unaware of the situation, around us today. And if you can throw some good information and awareness tips, that would be very, very helpful.
This being the Breast Awareness Month, it's very important that we have this discussion today, and it's more crucial for all the women out there to understand what are the risks that are associated for this breast cancer, more serious concerns that we are supposed to face around it, and how do we prevent us from getting into this situation, what are the screening methods that are available, all health related problems, whatever we are going to face with. So today we're just going to start off with some small questionnaire type of things so you all can understand how do we deal with the situation, what is the important steps that we need to take at each point of our life, and we take it further from there.
So, Dr. Sireesha, I think to start off, maybe some quick statistics is what I would like to, take everybody through, because it was very interesting even for me that it is one of the most common cancers, but nobody knows about it, They also say that 27% of all new cancers detected in women happen to be breast cancer. Increasingly the metro cities are actually having, maybe because of better awareness and they're able to detect it early. We are seeing the rise of cases in cities, but the problem is that only 60% of the cancers are for Indian women there is a post-cancer survival chance of 60%, whereas world over it is 80%. So maybe that is something you need to tell us why we are 20% lagging. I think these are all really, really important as to why we need to know more. So I'll start off with maybe the most basic question. What is breast cancer?
So when you're talking about getting back onto the first point that we discussed, why is that it is much less prevalent in Western countries compared to us. So when you're looking at it, there's a simple this thing that they quote in literature saying that in Western countries, the detection of the cancer starts off at millimeter stage, and in India it starts off at centimeter stage. So that is how it becomes, because they are more aware of their screening programs, whatever it is, may it be breast cancer, may it be cervical cancer, ovarian or anything else, even gut cancers and all. They are more aware of what is available, right. What are the situations that you need to go in for, where you need to get screened regularly, and screening early onset, starting off in an early stages when the right screening times are. These are all there, they're more aware of these things, and cancers are picked at much early stages. The benefit or the beauty of a cancer being picked up at early stages, you get to treat it well, you get to completion of the treatment is much more successful in those early stages, and most of the times you can try to get to understand the cancer or a pre-cancerous stage itself.
Yes.
Even it becomes a before it becomes a full-blown cancer, we try to identify it with our screening tools that are available, especially for the breast as well as for the cervical cancer, which is it's something that is done regularly over there, like every 3 years, every yearly in America and all, every yearly a woman gets to be offered a breast cancer, this thing. And in UK, European countries and all, every 5 years after 50, they all go on for breast cancer screening, which unfortunately is lacking in our country. I mean, these are not very expensive tests that we need to do, simple tests that we can do. As we go through our talk, we'll be discussing about how do we get ourselves checked for those things. And the only thing is the awareness. We need to promote the awareness. As medical professionals and people in the community who are there, who would want to, deal with this, is educating. We start off with educating, knowing that yes, these things are available for us, using the opportunity, get those screenings done, and being treated in an early stage. That's the beauty of it, so that we keep ourselves healthy and safe for long term.
So detection early is the key.
Early detection is the key to these things.
So what is breast cancer?
So when you talk about breast cancer, we've got a lot of tissues on the breast area. We have skin, we have fat tissues, we have ducts that give secretions when we are all lactating and all. So breast cancer is abnormal cells that keep producing in these areas where the fat tissues, that's called lobules of the breast, as well as the ducts. Some cells suddenly start growing in a different fashion. They're the same cells that we have. It's not something that comes up and sits over there. It is a programmed cell that has to function in a formatted way, just deviates from the path and starts dividing, multiplying, and becoming into lumps, cysts, and secreting tumors and all that stuff.
Okay.
So depending on the type of cancers that we have, they can be early localized cancers, they can be invasive metastatic cancers. And sometimes we do have very vigorous cancers called inflammatory cancers, especially breastfeeding women and all. Unfortunately, recently we just had a breastfeeding mother who had come in, delivered somewhere else, was being checked for these breast lumps and all. They thought it was an abscess, and then they just went on and treating her with antibiotics. And when she landed up, we definitely saw that it didn't look like an abscess. The minute we got a proper scan done and sent her to a breast specialist and all, it was found out to be a very malignant cancer of the breast. Very young, delivered just 3 months back. So these are the things that we need to be like, your awareness and knowing about these situations and all will definitely help us to deal with the situations better.
So what are the main causes, for the situation?
Yeah. So when you're talking about why it happens in some, it doesn't happen. Like we have so many women out in the world. It's not that every woman gets this, but there are certain group of women who are more prone for developing the breast cancers. So when you're talking about that, there's a small element of genetic cancers.
Okay.
You have around 5 to 10% of the whole cancer family having a genetic basis for that, in which you tend to find that in your family, very young relatives of yours would have suffered from a breast cancer under 30, 35, 40 and all, which is not a normal age for cancers. Or you have multiple groups of them, like your aunts, your cousins, they've all had breast cancers, even at 40, 50 years of age also. These are all where you tend to notice that sometimes there are some group of cancers that can happen. You tend to have breast cancer, ovarian cancer, gut cancer, and uterine cancers in families running around, each person having a different cancers. So there is a cancer related gene which is commonly called BRCA gene, BRCA1, BRCA2. These are the names that have been given to that. If any family members of yours, that you're aware that there's a lot of cancer history in your family, it is very important that you all go seek the help of the medical experts, find out whether you need to be tested for that specific gene. And then if you're found to be positive for that specific gene, then you need to be kept under a proper radar. You need to be screened regularly. You need to be given treatment options, what are available for you, how to protect yourself and keep yourself safe.
And these genetic screenings are available?
Yeah, they're available very much in India. There's genetists who will take you through the family history, identify whether you're at the right, you're the person to go through those tests and all. And the genetic testing is available. You get to know that you are positive for that, you're a high risk group of, in that genetic cancer family. It is very important that you
That's very good information.
Yeah, but if you look at it, it's a very small percentage. It's not like humongous percentage, 5 to 10%. The rest of them, they just happen. Commonly, when you look about why, there's a lot of lifestyle changes that have been happening of late. As you look at, women are becoming more, obese, less sedentary, basically. And all these vices, a little bit of alcohol, excess alcohol intake, smoking, all these things promote, and unfortunately delaying our motherhood, keeping our careers. I mean, obviously, yes, careers are also important for us, but for the God's gift that has been given to us is giving fertility, reproducing, feeding a baby, nurturing them, lactating. That is the best way that we can protect ourselves from breast cancer. So under 30, the best time to have yourself is to give birth to your child and feed the child as much as you can. And I wouldn't want you all to panic. Sometimes, unfortunately, we do have some women who cannot breastfeed for whatever reasons, but as much as you can, be yourself, more motivated for breastfeeding and all, so that yes, this helps you for preventing your breast cancer. on a long-term basis. So that is the key thing.
So, what would the signs of breast cancer be? Like, when do you how do you detect, or how would you know?
Yeah. So basically, when you're talking about when do we start off knowing that what we need to do, so any women from 25 years of age group, they should be aware of what they need to be doing for. That is called breast checking. Breast examination is what we normally say. So basically, we encourage them to go understand their breast, how your breast looks like, what is the shape of your breast. This is like you should be aware of it. Every month, stand in front of a mirror, check the shape of your breast, check the shape of the color of the skin on the breast. If there's any different puckering or pulling inside or redness, or there's a lump type of thing that you can feel in, and checking on your breast regularly using your palm of your hands. Don't hold your breast with your tissues, always hold the palm and try to palpate your breast gently all around in a circular motion or up and down motion, and the best way of learning it is from your medical experts. Just go and get it done once with a medical expert, at least 6 months to 1 year. Yearly once, you go and see your doctors. They'll check you, because whatever you check, they cross check it. It is always better, and you learn how to do the breast examination. Self examination is the key to this.
Is the key, yes. And there is it's very important to be aware
of it, how to do it the right way, and what you should be worried for and what you should not be worried for. Get all those symptoms and signs and all understood by the doctors first as you begin off. From the age of the 25, do not say that, okay, breast cancer is going to happen at 50, I'm going to start at 50. No,
right.
Please be aware of these things as early as you can, and then start doing those things. Self-examination. So this self-examination, we don't want you to be doing daily and then keep worrying about it. At least monthly once. Set a particular date in a month and then keep doing it, either before your period or after your period, whichever you're comfortable with, and keep checking on the breast. So anytime you notice there's an abnormal growth, or a lump, like a hard mass, or a discoloration, reddishness, or discharge coming from the nipple, or the skin being pulled into the breast, all these things these are the signs of breast cancer. Do not panic as soon as you see a lump, because sometimes there are a lot of benign lumps, like non-cancerous lumps are very common in women. Something like a fibroadenoma is what we call fibrocystic disease of the breast, and all are there. So if you go to your medical experts, what your doctors are going to do is they get the right test done, like a scan. A preliminary thing would be a breast scan. See what it is. If it's a benign thing, we'll reassure you and send you home. If it is something that needs to be looked into further, which would be with a biopsy, which is called an FNAC, fine needle aspiration, small tissues are collected, assessed, reassured, and sent back.
Right.
So that is how we take it as a first step.
So that's interesting. You're saying that, as early as, say, in your 20s, you should be aware of the changes in your, in your body, and, be aware of what needs to be done. And if you find any of these types of discoloration or abnormalities, the best thing is to contact a medical expert immediately. Right. We spoke about the signs of breast cancer, and you also spoke about the screening and how a person can screen for themselves. How often? You said maybe once a month, to be able to check either before the period or after the period, but keep it periodic, right? So that you have some kind of a schedule that is set up, right? Now, how would a person even know that they have? Because, in most cases, especially in our country, we have this thing to just brush it off and say, and then we listen to the next door auntie, we listen to our friends, we listen to our mothers, and the family more than a medical practitioner, especially when it comes to things like this. So how would you break into the next step, if cancer is detected?
So basically, once we get to know that, yes, obviously, as we discussed, for detecting a cancer, yes, preliminary tests are very important, like a scan followed by a biopsy. And yes, sometimes, we do use what is called a mammogram, but mammogram is not for full-blown cancers.
Okay.
That's for, we're talking about pre-cancerous screening or early cancer detections and all. So once we get to confirm the diagnosis of it, yes, please do follow the breast expert's advice. We do have oncologists who will be dealing with this breast cancer things. The earlier they're diagnosed, we have treatment options. When you're looking at treatment options, it may be a simple surgery depending on the type or stage of the disease that you have, followed with additional treatments depending on the nature of the disease. Like once you get to know the biopsy results, that is the final results of the type of tissue that is growing, your doctors, the oncology team will suggest whether you would require further treatment like a radiotherapy, like giving radiation to the areas of where the breast cells are dividing, or there's something called chemotherapy, where toxic medications which will help you to control the cell division, basically. That's called chemotherapy. Or then you also try looking at something called hormonal therapy. Sometimes you may require, your breast tissues can be like estrogen receptor positive, progesterone receptor positive. So depending on that, they will be suggesting some hormone therapy. So first thing is identification, getting to know that there is something that is happening, confirming the pathology. Once the pathology is confirmed, then you will be under a multidisciplinary team where a treatment will be programmed for you.
Right.
What is the best thing? And not delaying these treatments is very important. What studies have shown in people who avail the treatment options from the diagnosis to 35 days, in the sense roughly you're talking about 4 to 6 weeks. If you've started off with your treatment, you tend to have a better survival rate. Do not delay. Don't say that let me go to that temple, this temple, do that Ayurvedic therapy. People do that. That is how our communities are. It is not that you get to diagnose something, you go straight on and get treatment. You tend to take a lot of opinions. You go there, you go here, you try homeopathy, you try Ayurvedic. Then
but you're losing a lot of time.
A lot of time. That's the most important thing. So as the studies have shown that you start off your treatment within that 4 to 6 weeks interval from the diagnosis of the cancer, your survival rates are much higher.
That's very good information, doctor, because I think that's what happens, right? You tend to postpone treatment, or you go for multiple opinions, and that confuses the person even more, right? I think it's interesting to you also know about whether breast cancer is genetic, and you did speak about it. But is it like is there a percentage rate? And if, for example, somebody in my family had breast cancer, am I also going to have breast cancer? What is the statistic there?
Probabilities, yeah. So when we were talking about earlier, we said that it's a small percentage. 5 to 10% of all cancers are related to this genetic etiologies, like genetic related cancers. Once the genetic testing is done and you are found to be prone for that, you've got the gene demarked in you, then your doctors will advise how the screening has to be going on through. So let us say we were talking about post 50 people are offered screening and all, or in America and all post 40 till they start off in USA. So when you're talking about screening in these group of women who are genetically prone for, but they're very young, they're probably 25, they've not completed their families, you can't go ahead and offer a surgery for them, remove their breasts and all that stuff. But these have to be screened. How do we screen them? Regular checkups, with your doctors, and regularly getting MRI breast scans. Because in young age, mammograph is not going to detect the breast cancer very aptly. So more accurate way of assessing is an MRI breast for them. And regularly, yearly once, they should be checking in. And they also check to be under the radar for screening for ovaries also, ovarian cancers as well. They should not be left just like that. These group of women are usually advised to finish off their family soon, complete their family, having children and all, complete it. So don't delay it longer.
Right.
Finish your family, so that the rest of the treatments, if let us say if something gets identified, you need to go ahead with a mastectomy, removal of the breast tissue, removal of ovaries and all, these things will not be hampered.
Yeah. So there's a practical way of dealing with the situation.
Dealing with the situation.
Yes. I think there's, so many questions in women, right? And it's a good thing that, mentioned that if they are prone, then they need to start planning their life and their family, and that. So supposing that it is detected, what are the there's a lot of questions about treatment and their ability to have a family, like having babies and so on. So what do you say to that?
So when you're talking about, let's say you've been you're in the genetically prone family, or you've been detected to have it, and unfortunately you're the person who's going to be identified to be having a breast cancer, and you need a treatment for that. Yes, because of these treatments, either radiotherapy may not affect the fertility, but chemotherapy can affect the fertility. Your ovarian function may be different and all, or if your ovaries have to be removed, or let us say any treatment options that they have to be given. So you will have to sit and discuss all these aspects also. There are a lot of advanced techniques that are available of late, like fertility preserving. How do we preserve a fertility? Like, you're not ready, you're not married, but you've got a cancer. You can't be saying that go marry, go have a child and all. So we're going to look at the science that has advanced to help you to preserve. There's an ovarian preservation that can be done. There are techniques that are available where your oocytes, eggs can be preserved, ovarian tissue can be preserved. So treatment is important. So we should not be delaying a treatment if you've been diagnosed with cancer already. Finish off the treatment aptly, but at the same time, check with your doctors how do you have a less compromise on your condition, I mean affecting your fertility and all, because yes, help is available over there where you can use that. You have preservation, ovarian oocyte preservation also available, which can be later on used. Like once you're in the ready time frame, right frame of your this thing, have your partner or you have your family life going on ahead, then you can use the same tissue, become pregnant with your own egg, with your own genetic material, and that possibility is still there.
That's very good information and advice, because I think what you're trying to say is treatment is key and you can't delay treatment, but there are other ways to basically protect your fertility and have a child even post treatment.
Post treatment of your own genetic material. Yes. When we were talking about if you're in the breast cancer prone family, and unfortunately you've been diagnosed to have a breast cancer, but you're too young to have a family at that point of time, or you're not even married, you're not even set on with that, we would encourage you not to delay the treatment, because treatment is very important. Along with the treatment, you need to check with your doctors, because there are fertility preserving surgeries that are available. Surgeries in the sense, we can help you out with your ovarian preservation if needed. If the ovaries need to be protected, there's an oocyte preservation, there's an ovarian tissue preservation techniques that are available in the fertility world. So please check with your doctors before that, and do not delay your treatment just based on that you've not completed your family or have not had a child. So don't do that.
I mean, doctor, we always hear cancer is the big bad word, right? And everybody, once you hear of the term any kind of cancer, the next thing that comes to mind is the side effects, right? So what would the side effects of either cancer or its medication, and how do you treat that?
So when you're talking about the side effects of the disease, obviously with the breast cancer, when you're talking about if the breast tissue has to be removed, that's the first major worry for a female. Yes, with the breast tissue being removed, you're talking about the physical appearance and all, but then you have implants that are available. There are a lot of advanced implants that are there. I mean, earlier days, the implants were not well supported and they used to have a lot of problems with that. So the architecture of the breast tissue was slightly different, but the ones that are the advanced ones with mesh surgeries and all, they're able to protect the breast tissue. I mean, in the sense, they give the contour and shape and all. So physical deformities are not major. So that is how you protect yourself from the surgical problems.
Right.
With the chemotherapy, especially when you're taking those strong medications to prevent the cell division, cell spread and all that stuff, you tend to have a lot of issues like hair fall, hair loss or blood related conditions, because you tend to become, your blood cells start behaving differently and all. So you need a lot of good nutrition, because these are all temporary. They're not going to be permanent. They're going to come back again over time once your effects of the chemotherapy are gone off with. But proper nutrition, getting all the supplementary vitamins and all during that time, and good relaxation, calming down. Stress is not great at all at this point of time. So ensure that you're stress free, calm, think positive, and move on. And with radiotherapy, yes, pain at the site of the radiation and all is quite common. For that, your doctors, oncologists will be able to help you with pain relieving treatments and all. These are all temporary, not permanent. So that's what I was trying to say. Let us not worry about what are those things. Just to try to look at how early we can avail the treatments, how quickly we can contain the spread of the disease.
Right. So, other than the physical, a deformity of, say, losing, a breast, is there anything else that, that's going to impact your body, from the cancer itself? Yeah, no, not really, as long as it is, arrested at the right stage and, right treatment is taken for, unless it spreads off. Obviously, it spreads into different organs. That is when we tend to have a lot of other complications. That's like advanced stages. So the main, strategy of all these breast awareness months, awareness weeks and awareness days and all is to get us all to get to know the information, get to understand the breast and understand the need of screening tests as early as possible.
screen yourself, get to know your disease condition much early before you get into advanced stages, and get off with the simplest sort of treatments that are available.
Great. So I think the key takeaway is, early detection and to be aware and not to, hide it. It's something that's, happening, it's prevalent now, and there is medication that's available, there is surgery that is available, there's all kinds of treatment that is available. Cure is possible. Exactly. And you can continue to have a normal life, right?
Yes,
so I think that's the key message that you're trying to give onto this, and not to be led away by myths and stories but to follow the medical advice as much as possible.
Very true.
So anything else that you would like to add, Doctor? October happens to be the month, the awareness, for breast cancer. Women all around the world, need to know. And need to support one another. I think communities need to support this as well. So anything else that you would like to add?
Yeah, so that's what I would say along with these things. I mean, making sure that all these young girls who will be, in IT companies and all, you get a lot of information. It's out there. So please try and look at, dissipate to your family members. Make sure that every known young girls from 25 years of age, they are aware of all these programs that are available, get themselves assessed, screened regularly on regular basis, and especially along with the breast, I would also, reiterate on the cervical cancer screening also. These are the 2 screening tests that are available. Very easily done, very simply done. Getting them done, you tend to identify the disease much earlier than before the cancer becomes more stronger. Especially with the cervical cancer, when you're looking at it, you tend to identify a disease 10 years before it can become cancer.
Wow.
So that's the beauty of cervical cancer screening. Pap smear is available out there, and still in India, very few women would have got
would go ahead and get a test
done because of, there's a little bit of a taboo around it, myths around it.
Yeah.
There's a bit of a scare because this is very simple test. Even breast examination is such a simple test. You just need to go and visit your doctor yearly once at the most, get it done, be safe, be healthy. That is what I would convey it on to you.
And I think the key takeaway also is to be positive, stay healthy and be very positive.
Yes.
In spite of, if you may just be in that, percentage, but it's not the end of the
road.
Not
the end of the world. That's very true. Yeah. Because treatment is available in all aspects of this thing. So getting on there and getting to do the right things at the right time is the main thing.
Thank you, Doctor. I think it's wonderful meeting you and getting a lot of information. So and good luck with your next 10,000 babies.
Thanks a lot, Thank you.
Thank you.